Hey guys, my name is Hailey Prince. My presentation is titled Are Healthcare Providers in a Local Family Practice Clinic Counseling Patients age 18 to 60 with a BMI greater than 30 on lifestyle modifications for weight loss compared to the national average? I also want to acknowledge my faculty mentor, Dr. Christopher Jordan. Thank you so much for your help. This is my poster presentation. I will provide a detailed outline of this presentation and study. I hope everyone enjoys it. I'd like to begin my presentation with discussing what obesity is. It is defined as excess adipose tissue that is quantified via calculation of a patient's body mass index or BMI. This is done by dividing the patient's weight in kilograms by the patient's height in meters squared. Obesity is considered when the patient's BMI is 30 or greater. Obesity is an immense health concern worldwide and underlies many of the leading causes of preventable deaths. Some preventable diseases that occur with obesity include hypertension, hyperlipidemia, diabetes mellitus, cardiovascular disease, strokes, musculoskeletal disorders, depression, various disabilities, and of course, death. A healthcare provider must address the diagnosis of obesity and provide proper counseling and education on ways to overcome it or prevent the development of the comorbidities or death. The purpose of this study is to determine if healthcare providers are recognizing that a patient is obese based on their BMI, counseling them on lifestyle modifications to lose weight and prevent the development of chronic diseases, and documenting that it was discussed during the visit. This non-research retrospective chart review will provide information and insight to acknowledging that a patient is obese and counseling them on lifestyle modifications for weight loss management in the primary care setting. Awareness that there is a lack of provider compliance with this method will also be revealed. This project was conducted in a local primary care setting in a rural clinic in the northeast region of Arkansas. Data was collected using a randomized sample through a retrospective chart review. 50 charts were randomly selected between the dates of January 2019 to November 2019. The charts included patients seen in the clinic for problem visits or routine checkups. The sample included male and female patients aged 18 to 60 with a diagnosis of obesity or morbid obesity or a BMI of 30 or greater. Data was analyzed using Microsoft Excel software to define the statistical significance. Limitations to this study include that it was a small sample size of only 50 charts, there was one provider at the primary care clinic location, and data collection was from one rural clinic. Inclusion criteria include age 18 to 60, BMI of 30 or greater, an ICD-10 code of E66.9 or E66.01, active patients seen in the clinic between January 1st, 2019 and November 18th, 2019, and documentation of counseling of lifestyle modifications for weight loss management. Exclusion criteria are the complete opposite of the inclusion criteria. I'd like to take a moment to discuss this photo. It is most definitely an eye-opener or a revelation. These MRI scans may well be the two most powerful motivations for heart patients to step away from unhealthy tendencies. They are from a National Geographic feature all about body fat. The woman on the left is 5'6", 250 pounds, and has a BMI of 40.3, which makes her morbidly obese. The woman on the right is 5'5", 120 pounds, with a BMI of 20, which is considered healthy. Please note how the ankles of the woman on the left are now tortuously deformed due to the equivalent weight of one extra person she's been carrying around. I also want to note that the internal organs have so much excess adipose tissue surrounding them compared to the healthy person. This shows individuals that eating unhealthy diets and avoiding exercise not only affects the way that you look and feel on the outside, but it also debilitates you on the inside. The results of this study revealed that in this current clinic setting, 24% of the patient population who were diagnosed with obesity received counseling for weight reduction. This equates to 12 out of 50 charts. Although this percentage is greater than the national average of 18%, providers must work harder to increase this percentage. Weight loss management and prevention of obesity prevents the development of several different diseases or illnesses as mentioned. Recognizing obesity as a disease could lead to reimbursement for obesity interventions and may help providers focus their attention on strategies to manage the obesity epidemic. By losing weight or preventing obesity, individuals are preventing possible deaths and avoiding unnecessary healthcare-related costs. Because of this, it is crucial that providers are diagnosing obese patients correctly and providing proper counseling for prevention and management. In the setting where the project was conducted, it was noticed that for each patient's visit, the template only included an area at the very bottom of each chart to include education provided in a yes-no format. When counseling or discussion did take place, it was only documented under the Education Provided tab at the very bottom of the chart, which did not include details of the discussion that took place or specify what education was provided. It would be very useful to providers to add an area to the template labeled specifically for weight loss management, which would increase the occurrence of initiation of counseling and documentation of discussions. In addition to adding this template, there should be more options in the educational portion of the visit, other than yes/no to education for obesity. It should include what education was provided, if there were decisions made regarding diet or exercise, or if the patient refused education or counseling altogether. By making these changes, nurse practitioners can increase the occurrence of providing the needed education to obese patients. The provider should discuss with the patient the importance of goal planning, fitness tracking, and regularly scheduled check-in times for patient progress and motivation. It is imperative to counsel these patients every visit to prevent the increased development of comorbidities and to assist in the reduction of healthcare-related costs. It is our responsibility as primary care providers to provide proper education to our patients to inevitably save lives. Once again, I want to thank my faculty mentor, Dr. Christopher Jordan, for all of your help, and I hope everyone enjoyed my presentation. Thank you so much.